Hi everyone, my name's Dave and I'm a scientist. Yes, I used to own a brewery, but I'm here as a scientist today. And here are some thoughts about COVID-19. Ever since this COVID-19 pandemic started, the big question has been, what is the actual fatality rate? For a long time, they were just dividing the number of COVID-19 deaths by the number of confirmed cases, but confirmed cases is not the same as actual infections. But now we have some data. In the state of New York, they use the antibody test to test more than 3,000 people randomly. If you're positive for an antibody, that implies that you were previously infected by the virus. So this is a good estimate of the percentage of people who have been infected by the virus in the population. So we can use that and a little thing that I like to call math to do a simple calculation to estimate the actual fatality rate of COVID-19. So 14% of the population of this tested in New York were positive for the antibody. So we assume 14% have been infected. It's an estimate, but stay with me. 20 million people in the state of New York times 14%. That gives us 2.8 million total infected people. 17,000 deaths divided by 2.8 million. I will leave you to do the math at home, but it comes out to 0.6%. That's 6 people out of 1,000 who are infected have actually died. So we can calculate this fatality rate a different way. We also have data for New York City. 21% of the people in New York City tested positive for the antibody. And from the data that I could find recently, 123 COVID-19 deaths per 100,000 people in the city of New York. So using that value and 21%, do the 123 out of 100,000 divided by 21 over 100, which is 21%. You can follow the math if you want, but in the end you get 0.59%, which is very close to 0.6%, which would lead me to believe that it's a decent estimate. So let's assume that that's a good number, 0.6% fatality rate. So we, using that from based on infections, you can figure out how many fatalities there would be, but you can also do it the other way around. If we assume throughout the entire country that that's the fatality rate based on the number of people died, we can calculate how many people have actually been infected. And so the way you do that, you divide by 0.6%, you get 167. That means 167 infections for every person that died. 59,000 deaths in the United States times 167 gives us 9.9 total infections. So 9.9 million infections in the United States, which is 3.3% of the population of the United States. So it's still a very small percentage of the U.S. as a whole, compared to New York, which is 14% for the state and 21% for the city. But something that's even more cool is this New York City data is broken down by age group. So we can calculate the fatality rate for different age groups. Because we have the COVID deaths per 100,000 for these different groups. So from 0 to 17, the data I found was 0. It's probably not totally 0. I'm guessing they rounded down. So let's say it's less than 0.5 per 100,000. So instead of having a 0 fatality rate, I calculated a less than 0.0024%, which is less than 1 in 42,000 infections. So it is a number, but it is a very small number. Anyway, for 18 to 44, 0.06%. So that is 1/10 of the total. Remember, the total was 0.6%. So that's 6 out of 10,000. And then 45 to 64, that's mine. 0.5%, 1 out of 200. And then 65 to 74, 1.75, and more than 74, it's 4.2%. So very big difference, obviously going up by age. So based on that last data, so we calculated an estimate of the fatality rate for 19 to 44-year-olds having 0.06% fatality rate. So this is for the entire range. And we've seen that it goes up with age. So it's going to be less for 20-year-olds. And that also includes all the people with other medical conditions. So if you remove those, we were asking the question of what is the fatality rate for perfectly healthy, non-smoking 20-year-olds, it's going to be quite a bit less than that, I would say. We don't know. This is just speculation, but less than 6 out of 10,000, maybe 1 out of 10,000. So the fatality rate for, let's say, healthy 20-year-olds with no other condition is very low. It's not zero, so some percentage would die, but it's very low. What if some healthy 20-year-olds wanted to voluntarily become infected? And then they could get it over with. And then they would then be immune, and then they could live their lives normally. They wouldn't have to wear the fucking mask. They could go visit their friends and shake hands with people and visit their grandparents and not worry about hurting anybody again by just getting it over with. What if there was a system where they could do that and it would be done in such a way that they would be insured, they would be checked that they were healthy, and then it would be done in a safe way so that no one else got infected? Would that be such a bad idea? So let's talk about biomedical ethics. Biomedical ethics are guidelines in place to protect patients. And in the past, before these guidelines, patients were abused and taken advantage of and harmed. And so it's basically good. However, these guidelines basically do not allow you to ever endanger a patient, even when the risk is pretty low and the benefit is huge. And this is the way things are. These are the rules that everybody is playing by, and I feel like because of these rules, more people are going to be dying than have to. The trolley problem is a philosophical problem having to do with ethics. And basically it comes down to, do you kill one person to save 5? Here's the basic concept. You have a trolley coming down a track, and if you don't do anything, it's going to kill 5 people. There's 5 people standing on the track. Apparently, they don't know that the train's coming and they're going to get killed. But there's a switch here. So this is me. Does it look like me? There's a switch here. I can throw that switch and then have the train go down this way instead. But it'll kill that guy, kill that one guy. So do I do it? Do I kill him to save them? Interestingly, when they ask this question to people in all kinds of different cultures, there's a predictable percentage of people that will say always yes, and a percentage that will say always no. People say yes because less people dying is better. People say no because, I don't want to actually kill somebody. But if the bottom line is your actions should save lives, then you pull the switch. However, what if you did this in real life? Sure. Well, what would be you save them and you kill him? What would be the upshot? Well, you would have 5 people that are really grateful, and then one guy whose family would get a lawyer and would sue your fucking ass off, and that's what would happen. So, morality aside, it might not be legal. You might end up getting screwed, and that's why companies don't do things like that, because then you don't get blamed for being a bystander, but you get blamed by doing something, even if basically it's good. But what if you don't know that you're going to kill him? What if there's other tracks and other possibilities? And so let's say you only had a 0.06% chance of killing him to save those 5 people. Do you do that? I mean, then you don't know you're going to kill him, but there's a chance you could. And what happened if you did? His family's fucking lawyers would take you to the fucking court and you'd be screwed. Well, but what if instead of 5 people, what if it's, 1,000 people? Save 1,000 people for a small risk of killing somebody else. Furthermore, what if this guy wants you to do it? What if this guy's like, hey, I understand the situation, calls me up on a phone and says, hey, Dave, please pull the switch because I will take that responsibility. I will take that risk to save those people. I want to do it. I think I would pull that switch, but would the government do it? Would the biomedical community do it? In the real life situation that is analogous to this? Currently, no. And so those people are going to fucking die. So let's imagine that we are allowed to, in the safest possible way, infect volunteers, people who volunteer to be infected. And we start with very young, healthy people. What could we find out? Well, first of all, we could put this immunity question to the test. Have people who've already been infected with the virus and see if they can get infected again, and test them over time, and actually put data to it and quantify it. I'm pretty sure that we're probably fine, but let's check it, and then we'll have the answer. And between you and me, if there is an immunity, we are just so fucked that nothing else is going to matter. But anyway, then we can actually look at what is the actual death rate for healthy 20-year-olds. So for a perfectly healthy 20-year-old, it might be like 1 in a million. It might be so small, but it would be good to know, And then we could look at the time course of the infection. When you're exposed, how long generally, and what's the distribution of how long until you're contagious? How long until you have a headache or until you have a fever? And so do people have a fever like before they're infectious? So can we use fever as a proxy for infection to test for people to control the disease? And then how long are you infectious? And then look at that. It would be good to have that. And then we could also do experiments about how people can communicate the disease. So actually, for example, test on an airplane. If somebody's sick and they're on an airplane, how much are the other people at risk? We could actually do the experiments with actual people, actually healthy people, actually infected people. We could see if people get infected, because short of that, it's just a guess. And people say people at work in cubicles next to each other what's the likelihood of them getting infected? We could actually put numbers to this that would be useful and helpful in knowing how to limit the spread of the disease going forward. So then, once we've started to do these experiments and it's established that there's immunity, then people who have had the disease and therefore are immune then would get permission to do certain things. Like then you don't have to stay quarantined. You don't have to wear your fucking mask. You can go visit old people. And so like people who work with old people in retirement homes and nursing care facilities, only hire those people who can't get the disease, because that's the only way to really protect those people. The thing that sucks so much about the way this is you don't know who's infected. And you could be infected, other people could be infected. This is great big fucking unknown. If you just do it, if you actually choose to be infected and then you're over it, then you're good. And then you don't have to worry about it. And so people would sign up to be part of this. People would sign up to be infected and be immune to it. And so let's have a system where people can just voluntarily say, I just want to get this over with. Just infect me. I'll stay at home. No one else is there. Just let them do it. Or even have places where you could go and hang out while you're getting over the disease. If the chance of death is so small for these young healthy people, then there's really no risk. We just got to make sure that they're not out infecting people. And if you know you have it, then of course you're going to be much more rigorous in your quarantine. And so there's really no downside. And then let people volunteer. And at some point, first start with the young people, certainly. But at some point, I'd do it. Yeah, my chances are higher, but I want to get over this thing. This really sucks. And you ever hear this saying? Benjamin Franklin once said, those who give up liberty for security deserve neither. Does this apply? Are we giving up liberty for security? I don't want to give up my liberty. Life is too short to live in a fucking dystopian future where everybody's wearing masks and nobody touches and nobody leaves their house. This fucking sucks, and I really wish we could get it over with as soon as possible, because this is no way to live. Flattening the curve. That's what we're doing, right? With the masks and the hiding out, we're flattening the curve. So, but what is this curve? And so what is the unflattened curve first? The unflattened curve looks like this. You got cases here, and time goes on. In the beginning, it goes up exponentially, which means it pretty much doubles regularly. If it doubles 10 times, it goes up 1,000-fold. If it doubles 20 times, it goes up 1,000,000-fold. So it can go really high, but it doesn't keep going because it basically runs out of people. This means at some point, enough people have had it and therefore become immune that the pool of susceptible individuals is down. So in order for that to happen, a certain percentage need to have become infected with the disease. And so when we flatten the curve, we're way down here, let's say. Let's say we're like about here. We have a much fewer percentage of people that have been infected. So if hypothetically we went back to normal, it would go straight up like that, because we don't have any herd immunity. Herd immunity is when enough people have become immune that the epidemic starts to decrease. So what's going to happen? If anyone's betting that it's going to go away, don't hold your breath. So this thing about this plan about the contact tracing and stuff like that, I mean, yeah, it'll be useful, but they've never done that before. They act like they know it's going to work. I wouldn't hold your breath, but pretty much even Fauci says that the virus is going to stay around. So the virus is going to stay around. And we're having like 1,000 to 2,000 deaths per day. I think it wouldn't be surprising if we pretty much continued on that for a long time. And in the absence of a vaccine, that's going to have to go on until we have enough people who have acquired immunity. So this is going to go on for a really long time before we can go back to normal. So let's assume that that it's true that this is going to go on until enough people have been infected to acquire herd immunity. We don't know what percentage that's going to be, but since this is a very contagious virus, it's certainly over 50%. So let's just say 50%. Let's see what that looks like with respect to what would be the expected number of people that are going to die. 50% of every different age group ends up having to get infected. So in this table, I have the fatality rates for the different age groups, and this is 50% of the population in those different age groups. So multiplies that by that. We got like less than 1,000. It might be even very small number of the 0 to 19. 33,000 of the 20 to 44, and then 210, 250, and 420,000 of the old folks because of the very high fatality rate. Add it all together, 914,000 people projected to die the way things are going. So, but what if somehow we could choose which people get infected in order to get to that 50% herd immunity rate? Let's say we decided that we could, all of these, 100% of this group and 100% of that group were to get infected. And then none of these ones would have to, because that would be more than 50% of the population. How many people would be projected to die if that were to happen? It would be, like less than 2,000 here. Again, that might be like none or very close, but, and 66,000 here. But none there, none there, none there. So somewhere around 68,000 people would be dying in this scenario versus 914,000 in this scenario. I don't know. Which one would you do? Oh yeah, so what about a vaccine? If we get a vaccine, all the problems are over. Give everybody the vaccine. Well, they say it's going to take like a year and a half. Now I think that's longer than it needs to, but regardless, let's say it's a year and a half. And let's say people are dying still at like 1,000, 2,000 a day, and with certain places relaxing restrictions and all these things that are going to happen, who knows? It's probably not going to go down much. It might even go up in a lot of places. So let's just assume 1,000 a day. A year and a half is approximately 542 days. So 542,000 people. Yes, we won't reach our 900,000, but that's still a lot of fucking people. And if it were 2,000 a day, then we're going to reach our 50% mark and our 900,000. So that is kind of bleak. Do you not agree? So as things are now, all we're doing is slowing things down. It's like we're standing on the deck of the Titanic, but the ship is going in the water. And the same number of people are going to get wet. And it seems like there's an opportunity to actually take control of the situation a little bit. President Trump likened this pandemic to a war, and I think that that is a great analogy. And during a war, people who prosecute a war understand that people are dying. And so they risk people's lives to save other people's lives, to win the war for the greater good. When the Allies landed on the beaches of Normandy, there was a high fatality rate, but it was worthwhile. The people volunteered for that. They did it for the most part willingly, because we were fighting the Nazis and ridding the world for the most part of fascism, and it was good and it was worthwhile, and people didn't complain about it, and they just did it because it was necessary. And if there was that kind of attitude now, where people looked at this as a war and allowed risks, and people would, so if people could signing up to become immune, for every young person who does that, you're saving an old person, and like lots of old people. And so it would be a worthwhile thing to just, instead of joining the army, join the ranks of the immune. And if the more people who join those ranks, the safer all the vulnerable people would be. I don't know. Seems like it would be a good idea to me. So in the end, no one can really know what's gonna happen. It could just go away. There could be a drug. There could be a vaccine way faster than they're saying. All these things could happen. But I still think that there would be no harm in letting people volunteer for experiments to find things out, and allowing people to volunteer to become immune, and using immune people strategically in jobs where you don't want someone who could be infected. I think that regardless of how bad this ends up getting, that's not a bad idea. Those aren't bad things to do. And it's probably not going to happen, because even if, no offense to anyone who's offended, even if we had a competent president, I don't think that the biomedical community would go along with it. But we can't even get the normal shit done. So it's not going to happen. I just felt the need to put this out there. Thanks for listening.